This video is for COPD education and health literacy. In this video, we will be covering what COPD is, the causes, who's at risk, signs and symptoms, and a pursed breathing technique that can help people living with COPD when they experience shortness of breath. COPD is a term to describe progressive lung diseases such as emphysema, chronic bronchitis, and the refractory asthma. COPD is currently an incurable disease, so the treatments available for the time being are focused to relieve symptoms, preventing complications, and slow down the progression of the disease. COPD, or chronic obstructive pulmonary disease, is an ongoing lung disease that causes a gradual worsening of the breathing for an individual. Some causes of COPD is exposure to substances that can cause irritation to the lungs, smoke from a cigarette or secondhand smoke, cigars, pipes, and other tobacco substances, chemicals, air pollutants, dust, and toxic fumes, and also asthma. COPD and those at risk. Individuals that smoke or used to smoke are at risk of developing COPD. Also, a history of family members having COPD also increases your likeliness to develop COPD.
COPD signs and symptoms. In the beginning, symptoms and signs of COPD may not be evident. If signs and symptoms occur in the beginning of this disease, they usually are mild. As COPD worsens over time, the signs and symptoms associated with this disease become more evident and severe. Symptoms that are most common: constant cough or a good amount of mucus occurring when coughing, shortness of breath, especially during activity that is physical, wheezing, and tightness in the chest. More severe COPD symptoms are having a hard time talking or breathing. Fingernails or lips begin to turn the color gray or blue. The individual is unable to be alert mentally. A fast heartbeat, and treatment recommendations are becoming non-effective. Some COPD treatments include incorporating a healthy lifestyle into your routine to allow for an adequate nutritional intake, asking your doctor the type of activities you can safely involve yourself in, and therapy offered to help with one's breathing. Some suggestions for living with COPD are to avoid irritation to the lungs, eat healthy and exercise daily, have means to continue care, have needed items at easy reachable places, and to seek emotional support with a counselor and/or group.
The pursed breathing technique is going to help you with certain occupations that would help in our daily lives, such as getting dressed, transferring, meal preparation, exercising, and other occupations that could cause shortness of breath. Today we're going to be working on some pursed lipped breathing exercises. So these exercises are going to help you slow down your breathing if you feel it starts speeding up or if you feel any shortness of breath, okay? Okay, so first what we're going to do is we're going to breathe in through our nose, and we're going to hold it, so 1,002, and then exhale through your lips like you're blowing out candles. Perfect. And again. So a way to remember this would be to smell the roses and blow out the candles. Does this help you with your breathing?
Yes.
Excellent.